Whenever.
Okay, my name is Andrew. I will be responding to our opponent's topic, which is people under the age of 26 being allowed to stay in their parents' health insurance. So this falls under Obamacare, and what he said was that this program would not increase premiums noticeably. But that's based on research that's wrong, because according to research by Million Inc., the number basically we would increase premiums overall Obamacare. So according to the study, it says the number, it says the percentage of well, according to the study, the number of people with some kind of commercial coverage could increase their premiums by 7.4%, basically from 785,000 to 350,000. The percentage with some kind of government coverage or coverage provided by a private insurer but paid for in whole or part by the government could increase to 31% from 20% in 2010. Although the percentage of residents with coverage could rise by 7.9%, the price of the individual health insurance coverage might rise about 55 to 85%, excluding the impact of medical inflation. So basically, that's not an increase. That's a dramatic increase. And when it comes to people our age, 18 and 26, Obamacare will cost us pay a lot more, pay higher premiums. Young adults will pay high premiums under Obamacare because of this age rating system. Law stipulates that the maximum variation allowed in adults' premium is a cost ratio from 3 to 1. But research performed by Heritage shows that the natural variation by age and medical costs is about 5 to 1, meaning that the oldest group of non-Medicare adults normally consume about 5 times as much as medical care as the youngest group. So that was the research, and it says that Obamacare's rate compression causes insurers to charge artificially low premiums for older adults and higher premiums for younger adults. So basically, people in age brackets from 18 to 24 will have a 45% increase in premiums, and those who are at 25 to 29 will pay 35% more the cost than they should. And because older patients, older populations consume medical care more than younger adults. And that causes insurers to charge artificially low prices for their age bracket. And in order to compensate for that, they charge people 18 to 26 more for our insurance, which is a 55% increase, which isn't low, it's a dramatic increase. And according to MIT economics professor, Jonathan Gruber, using a micro-simulation model, he took into account 6 main requirements that insurance plans to cover. And basically what he found, this is something else, a quick summary, he found that basically young adults will increase, their premiums increase by 6%. And that pretty much is it.
All right, you ID the topic pretty clearly, and I think that you make a good argument trying to connect Obamacare to all of these issues and be able to apply some more generic information to the particulars here. You don't really follow a close structure of the advocates' arguments. You don't list what their claims were. You basically start developing a counterclaim on costs. And I think you do a pretty good job developing that counterclaim. You've got some evidence that suggests that there's going to be a 7.4% increase in cost, but then later on on, I heard a premium increase of 55 to 85%, so I'm a little unclear as to what that variation is accounting for and how it applies to this particular age category needs to be explained a little bit more. The next point that you talk about is an explanation about how the age group that most of the class here fits into is going to result in paying more for their premiums because they're going to end up having to subsidize older users of this material. And then you get an explanation about how older consumers use more of the medical needs than 5 times as much as people who are younger, but they can't afford to pay as much, and so the Obamacare actually kind of shifts some of the funding away, and that's why the premium costs are going to go up on younger people. And again, you had another statistic. There's a 25% figure here. So far I've got an estimate of 7.4% increase, 55 to 85% increase, a 25% increase. Later on there's another 55% increase, and at the very end I couldn't tell if you said a 6% or a 60% increase. So I got a lot of numbers that are going on here. Yeah, and I think that what you need to do is you need to break those down and have declarative sentences. Because sometimes what you're doing is you're presenting information that is perfectly legitimate information, but you're not telling us what it means. You need to make a declarative sentence and say, here's what this in the long run means. It means for people in this category, we're going to have an increase in the premiums. For the people who aren't covered but will be covered under their parents' programs, it means they'll be increased in this percentage category. And for those people who didn't have coverage before and now are going to be forced to have coverage, it's going to mean an increase in this amount. And all of those are subsidizing the older population. And I think that you need to simplify those kinds of claims so it all is much more straightforward. One of the things that you've done is you've found good information, but you're letting the information drive your speech. In other words, you are basically just reading evidence without telling us what the inferences and the claims are. And that, when we run into the debates, for instance, that we were talking about before, that'll be one of the mistakes that people make when they do the debates, is they just start reading evidence without telling us how does this evidence, what claim does it support, and how does that claim respond to the claim that the other side is presenting. And that's what we need you to do more of. All right, thank you.